that works with children and young people aged between 0 to 19 years who have a physical health condition and are experiencing difficulties adjusting to or coping with living with their condition. So we work with you, your family and your medical team to help you with coping with and adjusting to living with a physical health condition and all of the challenges that that might bring. We might offer some individual sessions of talking therapies such as cognitive behavioural therapy, acceptance and commitment therapy, or narrative therapies to help you explore your story, what's happened to you, and learn some strategies for coping with difficult feelings. We might offer to see you and your family together, or we might even invite you to our specialist family therapy clinic. Sometimes we might offer to see you in a group or ask you to join one of our workshops alongside other young people who live with similar medical conditions. We know that some young people have had a really difficult time in hospitals, so we might talk to you about specific therapies that could help with this. If you have any medical procedures or interventions coming up that you might be anxious about, we can also help you and your medical team to prepare for those. Finally, we might offer a cognitive assessment for young people who may be struggling with any aspect of learning or paying attention in school that might be related to your medical condition. This could involve doing some puzzles and tests to work out your strengths and weaknesses and come up with a plan for how your school and the adults around you can support you.
So a physical health condition is just really about the condition of your body. So we support young people and children with lots of different types of physical health conditions like type 1 diabetes, eczema, asthma, epilepsy. Now there are other types of physical health conditions that can be present from birth, like congenital heart disease or cystic fibrosis. But there are a lot of medical health conditions, physical health conditions, that can just arise at any time during your childhood or your teenage years. And the process of getting used to a new diagnosis can actually be really challenging sometimes. So adjusting to a diagnosis is also something that we support with. And as a team, we're really aware that health conditions can have a really high burden to them. And what that means is that it just takes a lot of kind of hard work and effort from the child, the young person and their parents or carers to look after that health condition. So having lots of medical appointments, having to have surgeries, injections, treatments, procedures, blood tests, all of that can kind of get in the way of you doing the things that you enjoy, like going to school, sort of playing with your friends, meeting up with your friends, doing your hobbies. So those are things that we can support around as well. You can see us in various places. This might be at a CAMHS base in the community or at the hospital. And sometimes we may even be able to see you when you're in the hospital for a stay, for example, upon the wards or in the outpatient department. And if you live a long way from Leicester or it's difficult for you to travel because of your medical needs, we can also see you via video.
Our team is made up of a variety of healthcare professionals who specialise in working with young people who have mental health difficulties associated with their physical health condition. Within the team, you might meet clinical or counselling psychologists, a neuropsychologist, mental health nurses, psychiatrists, or family therapists. We also have lots of assistant psychologists and psychologists in training who are often on placement with us. Finally, our fantastic admin team who will help to book you in and greet you when you arrive.
To see our team, you need to be under the care of a medical consultant, either in the community or in the hospital, and they can refer you. You can't refer yourself, but if you are concerned about your well-being in relation to your physical health condition and you feel you would like support from our team, you can talk to your medical team, the consultant, the dietitian, the physiotherapist, or your specialist nurse, and they can discuss with you about how to get a referral.